Vitamin D is a nutrient that helps your body absorb calcium and phosphorus, which are essential for your bones, teeth, and muscles. It also supports your immune system and helps prevent infections. But did you know that many people are deficient in vitamin D? According to some studies, up to 50% of adults and children worldwide have low levels of vitamin D in their blood. This can lead to serious health problems such as rickets, osteoporosis, osteomalacia, depression, diabetes, and more. So, how can you tell if you are deficient in vitamin D? Here are 7 signs you should never ignore. 1. You feel tired all the time. One of the most common symptoms of vitamin D deficiency is fatigue. If you lack vitamin D, your body may not be able to produce enough energy from the food you eat. This is because vitamin D helps your cells produce energy by activating certain enzymes and hormones. You may also have trouble sleeping or feel sleepy during the day. This can affect your mood, concentration, and productivity. 2. You get sick often. Another sign of vitamin D deficiency is frequent infections. Vitamin D plays a key role in regulating your immune system and fighting off bacteria and viruses. If you don't have enough vitamin D, you may be more prone to colds, flu, bronchitis, pneumonia, and other respiratory infections. You may also take longer to recover from illnesses. 3. You have bone or muscle pain. Vitamin D is essential for maintaining your bone and muscle health. It helps your body absorb calcium and phosphorus from your diet and deposit them in your bones and teeth. It also helps your muscles contract and relax properly. If you are deficient in vitamin D, you may experience bone pain, especially in your back, ribs, hips, and legs. You may also have muscle weakness, cramps, or spasms. 4. You have hair loss. Vitamin D is involved in the growth and maintenance of your hair follicles. It stimulates the production of keratin, which is a protein that makes up your hair strands. Hair follicles are the tiny structures under our skin that produce hair. They go through different phases: anagen, which is growth phase; catagen, which is the transition phase; telogen, which is the resting phase; and finally exogen, which is the shedding phase. Normally, about 80 to 90% of our hair follicles are in the anagen phase, while the rest are in the other phases. This ensures a healthy balance of hair growth and loss. However, when we have low levels of vitamin D, this balance can be disrupted. Studies have shown that vitamin D deficiency can cause hair follicles to enter the telogen phase prematurely, leading to increased hair shedding and thinning. 5. You have mood swings or depression. Vitamin D is not only good for your physical health, but also for your mental health. It affects the levels of serotonin and dopamine, 2 neurotransmitters that regulate your mood, emotions, and motivation. If you are deficient in vitamin D, you may feel sad, anxious, irritable, or hopeless. You may also lose interest in things that you used to enjoy or have trouble coping with stress. 6. You have poor wound healing. Vitamin D is very important for your skin health and wound healing. It helps your skin cells grow and repair themselves after an injury or infection. It also helps prevent inflammation and infection by activating your immune cells and producing antimicrobial peptides. If you are deficient in vitamin D, you may notice that your cuts, scrapes, or burns take longer to heal or get infected easily. 7. You have low blood calcium levels. Vitamin D is necessary for maintaining normal blood calcium levels in your body. Calcium is a mineral that helps your nerves, muscles, and heart function properly. It also helps your blood clot and regulates your blood pressure. If you don't have enough vitamin D, your body may not be able to absorb enough calcium from your food or release enough calcium from your bones into your bloodstream. This can cause hypocalcemia, which is a condition where your blood calcium levels are too low. This can lead to numbness, tingling, muscle spasms, or seizures. If you had any of these signs of vitamin D deficiency, you should talk to your doctor and get tested for your vitamin D levels. The normal range for vitamin D is between 20 to 50 nanograms per milliliter of blood. If your level is below 20 nanograms per milliliter, you are considered deficient and you may need to take supplements or increase your exposure to sunlight.